2 or so questions. What feedback, if any, have you received from patients about Benlysta?
Yeah, I mean, I think patients are, they're very happy to have other options. I think that's the big thing, is that many of my patients have, they've felt that lupus has lagged behind. And it's true, other autoimmune diseases. And so they're very happy that there's this option available to them. They're always excited by that. I think I prepare people ahead of time that they're not going to have this major effect early on, and so they don't get their hopes up that all of a sudden, they're going to start Benlysta and then next week their arthritis is going to be gone. I really spend a lot of time educating them, and so I don't have people that are really disappointed with it. I really haven't heard a lot of negative things. I just think that if after 6, 7, 8 months people aren't feeling a significant difference, that's when they just say, I'd rather not be giving myself injections anymore. But with the injections, so that's really what it is. But there haven't been a lot of, again, I have not seen people complain about side effects or injection site reactions, anything like that. It's been a positive experience overall.
Okay, got it. And in general, what's your level of satisfaction with the current therapies that are out in the market right now, and the standard therapies as well, like including the Plaquenil, things like that?
I mean, I think we have a long way to go. The current oral medications are associated with significant side effects. They're difficult to take, difficult to adhere to. So I think we have a lot of room for improvement, and I'm not happy with what we have available to us. We need new therapies that work well, that are tolerated well, that patients are able to take. So I'm not satisfied at all with what we have available to us. And you think about even with renal lupus, with cyclophosphamide, the toxicity of that drug, it's such an old drug, why do we still have to use that from the 1970s?
Right.
And steroids. I mean, we're still so dependent on steroids in the acute setting for acute inflammation and unacceptable side effect profile. And we see the effects of the cumulative side effects and damage that are caused by these drugs. You mentioned hydroxychloroquine and, eye toxicity. We're learning more about, after 20 years of being on that drug, a significant amount of patients have macular, toxicity. And so I'm not happy at all with what we have. And, we really need new agents. And I feel like the pipeline is pretty full right now. So I'm excited to see what the future brings. Yeah.
And did you feel like Benlysta helped with any of those kind of unmet needs and concerns that you were having?
I do think it helps. And I think that, I think the problem right now in lupus is lupus is such a heterogeneous disease, and we mix everyone together. And we try, arthritis even. We say, okay, these people have arthritis. Well, arthritis in different people is probably, a result of different pathways. And so we have this very crude way of categorizing people in terms of organs, arthritis, rash, and yet the pathways that underlie those manifestations are likely very different. And until we understand those pathways, and until we have biomarkers, we're not going to understand who would benefit from which medication. And that's the struggle with Benlysta. I think it's a wonderful thing that we have it available to us. It's been a huge step forward, but we're still struggling with who do we use it in, How do I define my patient population that's going to get benefit from it? And so we need to continue to work on the biomarker side to try to understand that so we can use our drugs in a more rational way. And that's going to be even more important when we have new biologics available to us.
Okay. Yeah, that definitely makes sense. Awesome. So just as we wrap up, because I know we're getting to the top of the hour, did you have